bring my slides to you, and we'll start it. Okay, now let's get started with the rest of slides. This video is really useful for you guys. While I am lecturing, you may think about it, okay? What does breathing means, inspiration, expiration means, and which are the events during the inspiration and expiration are really, really important to you guys, okay? We know that breathing or ventilation is other name of breathing, is the mechanical process of moving air from the environment into the lungs, which we call inspiration or inhalation, and of expelling air from the lung uh, to the environment, we call expiration or exhalation. These two events together we call ventilation. Thoracic cavity is the body cavity in which the lungs are located, and there are two pleural cavities which I told about it in the last lectures. One for each lung. We have two pleural cavities, which is filled with a small amount of fluid and prevent it's make easier for lung to inspirate and expirate. Okay, diaphragm defines the bottom of the thoracic cavity, and we also have intercostal muscles, which are really important for inspiration. Because these intercostal muscles, they run along the ribs, defining the size of the thoracic cavity. Once they get contract, and they will expand the thoracic cavity and also allow the air come into the lungs. The contraction and relaxation of the diaphragm and intercostal adjust the size of the thoracic cavity for inspiration and expiration. Okay, here you see the summary of inspiration, which kind of events we have in inspiration, what happening in order to get a efficient inspiration, to get enough air in our lung. It is really important. Okay, diaphragm and external. I may annotate it for you guys. Okay, and then let's see. Check here and here. Okay, for inspiration, diaphragm and external internal costal muscles, as you see here, contract, and the size of the cavity increases, as you see here, because the chest is expanded, okay, and the size of the cavity is increases, allowing lung volume to expand. If you go through the events to steps of inspiration, as you see, first muscles contract, the diaphragm descend and rib cage rises, okay, and which result thoracic cavity volume to increase, and lung, by the way, the stretch and intrapulmonary volume is increases, okay. Intrapulmonary pressure will decrease, okay, below zero, okay. what is the pressure of air outside of the lung? Do you know that? Okay, we will consider as zero, okay, but I will talk about that. Okay, once we have minus intrapulmonary pressure, okay, and then air flow into lung down is pressure gradients until pulmonary pressure is zero, equal to atmospheric pressure. Okay, keep in mind, always gases are flow the direction. The direction they flow down its pressure gradients. Okay, from high pressure um, um, from the high pressure space to the low pressure space. Okay, increasing the volume of the lung causes decrease in pressure and causing air to passively flow into the lung down a pressure gradient. This whole process is about inspiration. Okay, you have to memorize or to understand what happens during inspiration. Okay, these slides are really important. Also, the video I showed you before. Okay, keep in mind that the contraction of the intercostal muscles cause rising of the ribs, okay, which result in expanding of our thoracic cavity and decrease the intrapulmonary pressure, and therefore air from outside is flow inside of our lungs. Okay. Now let's get forward. This is about expiration or exhalation. Okay. Once we expel the air out from lungs. Okay. The mechanism is almost the same, but the events is vice versa. Okay. Here, once the intercostal muscles relax, okay, and then ribs and sternum depressed as the external depressed, and then the external the cavity, okay, the thoracic cavity volume decreases, and intrapulmonary pressure rises about zero, and which means air flow out of the lung down its pressure gradients until intrapulmonary pressures is zero. Okay, this expiration and inhalations is always running while we are now talking. As you know, it's happening 20 times per minute, okay, in adult peoples. Okay, it depends on age, exercise, and our efforts. And once we get, once we exercise, we need more oxygen, and then the rate of ventilation will increase. Okay, ventilation means expiration plus inspiration. Okay, the both events together we call ventilation. Okay, in order to exchange oxygen and carbon dioxide in our body, in our lung. Okay. Okay, you may know from the previous lectures, okay, the total pressure of a complex gas is the sum up of the partial pressure of the individual gases. As we know, in our environments, in the atmosphere, we have nitrogen, oxygen mainly. About 78% of the atmospheric airs is include nitrogen, 21 uh, uh, percent is oxygen, okay, and the rest of the air is include other gases, okay. But most important two gases are nitrogen and oxygen in our atmospheric airs, okay. That means what I mean one at 1 atmosphere, uh, which means 760 millimeter mercury, the partial pressure of oxygen is about 160 millimeter mercury, okay? Because 21% of the 760 millimeter is oxygen. When you calculate, you will um, come up with 160 millimeter mercury. Okay, this is the partial pressure of oxygen in our atmospheric airs. Okay, what is the partial pressure of the oxygen in lung, and what is the partial pressure of oxygen in our blood? These are really important because the circulation of the exchange of the oxygen is depend of these partial pressures, okay? Because the gases, they move from high partial pressure space to the low partial pressure space, okay? Okay, now how does air get from the lung to the other cells, okay? And we know oxygen can leave the alveoles and carbon dioxide can enter it, okay? But how does it know which way to go, okay? How does do the gases know which way to go? This is really important question to answer them, okay? If you know that the gases are move according to the partial pressures, okay, from the highest partial pressure to the lowest partial pressure space, and then you get the answers, okay. We will just talk about it in a few minutes, okay. Now, as you see here, the oxygen and carbon dioxide molecules diffuse across the respiratory surface in direction of the partial pressure gradients. As you see here, we have oxygen, uh, the oxygen partial pressure in the alveoli about 105, okay? Outside of our body in the atmospheric pressure is 160, in our alveoli is 105, okay? But in the blood circulation, the partial oxygen partial is 40 millimeter mercury, okay? As you see, there are big difference between the pressure, partial pressure of the oxygen. That means oxygen should move this direction from outside of our body into lung, into alveoli, and enter to our vessels, okay? Because this is um, uh, directed by the partial pressure gradients, okay? Or on the other hand, carbon dioxide or oxide partial pressure is highest in the cells. As you see here in the capillary alveoli, we have 45 millimeter mercury of carbon dioxide partial pressure, okay? And in the alveoli, it is 40, okay? And in the atmospheric air is really too low, okay, is close to zero. That means oxygen and carbon dioxide should expel from alveoli to the outside. Okay, this is also because of the partial pressure gradients of the carbon dioxide. Okay. Now Let's talk about a respiratory pigments, which we know, you know, also hemoglobin, okay? We also will talk about hemoglobin in the future in specific lectures, but there are a few slides about that. Respiratory pigments, which are hemoglobin and myoglobin, but most important one, which is transport oxygen from lungs to the body cells, is hemoglobin. Okay, keep in mind. And myoglobin is also a protein which is a storage, which store hemoglobin, oxygen inside of the cells. Okay, as you see, hemoglobin has 4 subunits. Okay, and each subunit included a um, protein. Okay, which is include iron. Okay, we call heme. Okay, in each hemoglobin molecule we have 4 heme and 4 iron molecules, and these iron molecules, as you see here, they are able to bind oxygen. Okay, that means uh, we carry oxygen from uh, from lung to the body cells via hemoglobins. Okay, why we need hemoglobins? Okay, we know that the gases, in order to diffuse through the membrane, they should be dissolved. Okay, and in our blood, we have, and in our body, we have about 5 liters of blood. Okay, and there is a limitation for oxygen to be dissolved. Okay, uh, only 5% of the oxygen can dissolve in our in a water in our blood, but we need more oxygens uh, for our cells. Okay, and therefore hemoglobin will store the more oxygen for us and transfer it to our cells. Okay, without hemoglobins, okay, we cannot obtain um, enough oxygen for our cells in order to maintain their life. Okay, once you lose hemoglobin in our body, okay, you may know that in adult people, we have about 50 gram per deciliter of hemoglobin. Once you lost hemoglobin, okay, you lost blood. Okay, you also lost hemoglobin. That means you lost the capacity of oxygen. Okay, and then in order to get more oxygen, you have to increase the rate of the ventilation. Okay, you have to inspirate and expirate like this. Okay, uh, in order to get enough oxygen for body. Okay, therefore hemoglobin is really important. Okay, the amount of hemoglobin which commonly is measured when you see a doctor. Okay, this is for maybe the common test that we are measuring in hospitals. Okay, um, because hemoglobin both a storage form and transfer form of oxygen in our body. Okay, it store uh, a plenty of oxygen uh, in it, which is really important for our body cells. Okay, hemoglobin is a protein. Okay, and composed of 4 peptides. And in adult peoples, these peptide change typically to alpha to beta change. Okay, and each chain, okay, each subunits um, attached to him. Okay, as you see here, and there are a iron molecule in each heme which bind oxygen and carry them to our body cells. Okay, oxyhemoglobin means oxygenated hemoglobin. Once once oxygen bind to the, as you see here, hemoglobin, oxygen. Once oxygen bind to hemoglobin, we call oxyhemoglobin. Okay. Once is removed from hemoglobin, we call deoxyhemoglobin. Okay. Hemoglobin without oxygen. Okay. 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 Diffusion of gases are really important. You need to know the mechanism of action of gas diffusion. Okay, what happens at the alveoli level? What happens at the tissue cells? Okay, and all these events is depend on the partial gas pressures. We know that the partial pressure of oxygen at the alveoli surface is about 100, 105, okay? And once the oxygenated blood comes into the lungs, okay? That means uh, the oxygenated means the oxygen poor blood, okay? At the pulmonary capillary, since we have a high oxygen blood pressure in alveoli, okay, that means the oxygen will flow into the capillary, okay, and um, uh, and then we will oxygenate uh, our bloods in the pulmonary capillaries, okay, because of the partial oxygen pressure gradients, okay. Uh, okay, what happens with the carbon dioxides? Okay, we may see them later, okay. What happens with the carbon dioxides? Okay, uh, as you see, the pressure of the carbon dioxides is higher in the capillary vessels, okay, than the alveoli and then the outside of the lungs, okay. That means carbon dioxide will move from the capillary vessels into alveoli and finally outside of the lungs, okay? This is also directed by partial gas pressure, okay? The partial carbon dioxide pressure, okay? Okay, carbon dioxide transport is really important, like oxygen transports, okay? Because the carbon dioxide is a byproduct of our metabolism, okay? We need to remove them from our body, okay? Once is produced, is the carbon dioxide is converted to carbonic acids by help of the carbonic anhydrase. Carbonic anhydrase is a most potent enzymes in our body, okay? It's converted 1 million carbon dioxide to the carbonic acid in 1 second, okay? It is most potent enzymes in our body, and it's converted carbon dioxide to carbonic acids, and then carbonic acid is converted to bicarbonate, okay, spontaneously once in our bloods, okay, and that means okay, the 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 most important part of the carbon dioxide is transferred in our blood as a bicarbonate, okay. Once I ask you what is the most important portion of the transfer form of carbon dioxide, you may answer bicarbonate, okay. Bicarbonate is a transfer form of the carbon dioxide in our bloods, okay. Okay, you see here, okay, carbon dioxide exchange in tissue, okay, and we also you will see in alveoli, okay. In tissue, okay, we have high tissue cells are rich in carbon dioxide because carbon dioxide is a byproduct of metabolism of carbohydrate and lipids and proteins. Okay, that means our cells produce a huge amount of the carbon dioxide, and as you see, uh, the uh, the amount of the carbon dioxide is higher um, in the tissue cells. Okay, that means here, okay, in the tissue cells, these carbon dioxide, because of the partial pressure of carbon dioxide, it should be um, pass through the tissue capillary wall and come into capillary walls, into erythrocytes, into red blood cells. Okay, once reach into the red blood cells, there are a carbonic anhydrase, okay, which has a potent activity and converted it to carbonic acids, and then bicarbo is the carbonic acid is converted to bicarbonate spontaneously, and about 60% of the carbon dioxide is transported in bicarbonate ions through our bloods, okay, in order to remove them from our body, okay. Carbon dioxide exchange in the lung, okay. The previous one was in the tissue, okay. Now, as you see in the lung, okay, uh, we we have high carbon dioxide partial pressure in the capillary, pulmonary capillary, in the erythrocytes, okay, but low pressure in the alveoli, okay. That means carbon dioxide here, the bicarbonates is converted to carbonic acids again, okay, and then is the reverse reaction is happening. You may know the enzymatic reactions, which direction they should go. It depends on the amount of the substrate, okay. Once we have here a high amount of the bicarbonate, okay, and then it will go the direction of producing carbon dioxide, okay? And the carbon dioxide, it will move into alveoli um, uh, because of the partial um, carbon dioxide gradients, and then expelled from alveoli outside of the lung, okay? I hope that will be helpful for you guys to understand the mechanism of action of ventilation and gas exchange. Okay. Now I have a few slides, then we will finish, and I will be ready to get your questions. Okay. Okay, blood cases and the health factors are other issues that we need to talk about. Okay. And you may know month-to-month resuscitation. Okay, it can be used for people who have stopped breathing due to drawing, smoke inhalation, or electric shock. Okay, and cardiopulmonary resuscitation is a method for aiding victims of respiratory and cardiac arrest. Okay, and cigarette smoking factoids is really big health issues nowadays. Okay, 15 puff on a cigarette during a 5 minutes period increases airway resistance as much as threefold. Okay, that means it's prevent gases to come in uh, and go out. Okay, smokers are 20 times more likely to develop chronic bronchitis and emphysema. Okay, and about 90% of all deaths from chronic obstructive pulmonary disease are caused by cigarette smoking. Okay, smoking shortens the average of the lifespan of adults may in male about 30 years and in females about 40 years. Okay, please think about this information if you smoking and think about it again and again. Okay, as you see here, okay, uh, the effect of pollution on our lungs, okay, the lung of smoker and the lung of the non-smoker, okay, and cigarette smoking is a major factor in most lung disease, okay. It affects the entire of our body, but especially our lungs, okay. It causes chronic bronchitis, okay. It causes pulmonary emphysema, okay. We lose space for actual gas exchange, okay. It causes chronic obstructive pulmonary disease, okay, which is occurrence of chronic bronchitis and emphysema. It's also causes lung cancer, okay, uh, which is also most important health issues nowadays, okay. Asthma, a common chronic inflammatory disease of airways characterized by variable and recurring symptoms, reversible airflow obstruction, and bronchospasm. Okay, uh, wheezing, coughing, chest tightness, shortness of breath are some important symptoms of asthma. Okay, uh, it's caused by allergic hypersensitivities. Therefore, we are using steroids, okay, and some adrenergic agonists, which relax smooth muscles and help patients to inspire enough, okay. And cystic fibrosis, you may be familiar with, okay, is caused by genetic mutation of chloride ion transporter, as I told before, okay? And people who have cystic fibrosis have thick and sticky mucus that build up in their airways, as you see here, and prevent airflow, efficient airflow. Also, it is easier for bacteria to grow and cause infection. Okay, infection here. Okay, this is for your information, you guys. Okay, um, about 80% of coronavirus deaths in China are from smoking. Okay, and 85% of the death in the US are from smoking, okay? And most important things, 90% of the healing patients are those who don't smoke. Okay, this information may give you some sense to think about if you are still smoking, okay?